Hey everyone, Dr. Aaron Moreland here with Vallejo Health and Wellness Center. Today I want to talk to you about your low back, and I specifically want to talk about one part of your low back, and that's this joint right here. It's L5 and S1. So the L5 vertebrae and your sacrum, they form a joint called the L5-S1 joint. There's a disc right here. This is the most herniated disc in your low back. And the reason why is it takes a lot of stress, but also the reason why is you're going from a part of the spine that moves quite a bit to a part of the spine that doesn't move much at all, and that's the pelvis. And so that can cause a lot of load, a lot of shearing, a lot of stress on that area. The other thing that causes a lot of stress on that area is if we're sitting a lot. And most people have jobs where they sit most of the day, and so then this area here can become very unhealthy and that disc can start to herniate. One of the reasons why that happens is when that joint locks up because we're sitting too long. This L5 starts to almost act like your sacrum. It doesn't move much. And I did a video on this a while back on the disc getting dehydrated. If that joint isn't moving, that disc gets dehydrated, blood flow can't get in, nutrients can't get in, waste products can't get out, and then that becomes unhealthy and prone to herniating, okay? So what I wanna do today is show you a few exercises that you can do to make that joint move and be as healthy as you possibly can be. But a couple caveats with that is one is that if you're dealing with a herniated disc, I'll tell you which ones these exercises that you shouldn't do. If you're dealing with what they call stenosis, or that's where this hole right here gets smaller because the disc gets thinner, or you get degenerative changes in the joint, you get bone spurs that makes the hole smaller, there's a few exercises that you wouldn't do for that. So if you have stenosis, I'll tell you which exercises to not do. Or if you have what they call facet syndrome or facet arthritis, where this joint here is degenerated or inflamed, there's a few of these exercises you don't want to do. But if you have a healthy spine already and want to just keep it that way, you can do any of these exercises. And they're just a nice, gentle way to get that disc in that low back, and especially between that L5 and S1 moving. So I'm going to show you the first one, and you're probably familiar with these exercises, but this is a cat to a cow. Okay, so I like to do it where I'm not holding it, I'm literally just pumping. So it's almost like an anterior pelvic tilt to a posterior pelvic tilt, and I'm just pumping that joint. Okay, so now if you have a herniated disc, this here, the cat, would actually probably be painful. You wouldn't want to do that. If you have facet arthritis or you have stenosis, going into this cow position would not feel good, and you'd want to avoid that. So I like to do this again. If you have a healthy spine, I just go from cat to cow to cat to cow, and then I move into child's pose. So again, if I have an unhealthy disc, I have a herniated disc, I am not going to want to do this. It's probably not going to feel good, so I'd avoid it anyways. And then I'm going to go right to cobra, go to cow, or to child's pose, I should say, back to cobra. Now, if I have facet issues, if I have stenosis, not going to want to do this exercise probably. But if I have a disc issue, this is going to feel really good. They actually call this a McKenzie position. Sometimes it's just done from the elbows, but that's what I do. Then the last thing I'll do is I'll go up to, we call this down dog, to up dog, to down dog, up dog. And again, if you have a disc issue, down dog probably won't feel very good for you. And if you have facet or stenosis, doing an up dog probably won't feel very good either. But that can take maybe a couple minutes to do those exercises, and really gets that motion in your low back and can help keep that back, that disc hydrated and as healthy as possible. So hopefully that's helpful. This is Dr. Aaron Moreland with Vallejo Health and Wellness Center. Have a great day. God bless.